for joining us. Today we are going to start webinar series which is on nursing theory and their application. This webinar series is organized by the Nursing Teacher Association of India. I am Ravinder Kaur, Vice Principal, Mata Gujari Institute of Nursing, Jalandhar, Punjab, and it's my immense pleasure to act as a moderator of today's webinar. Topic of the today's session are introduction of nursing theories and their application, and second topic is Dr. Patricia Benner from novice to expert theory. If you have any question during the session, then you can drop your question in QA box and I will bring them up at the end of the session. Now, I would like to introduce our resource person, Dr. Nisha Clement. Now, presently she is working as an associate professor at ESIC College of Nursing, Bangalore. She has done her BSc Nursing and MSc Nursing from Dr. MGR University, Chennai. She has done her PhD Nursing from Shri Ramachandra Medical University and Research Institute, Chennai. She is a member of different professional societies of India. She has participated in more than 40 scientific paper presentations. She is the author of 18 nursing textbooks. So many times she has acted as a resource person in workshops, seminars, national conferences, and online webinars. She has also participated in near about 40 international webinar. She is a LIC inspector. She is also appointed as a PG external examiner. She is a chief editor of MAT journal. She is really having a wide variety of experience and achievement. So I extend my heartfelt welcome to Dr. Mrs. Nisha Clement, ma'am. Now, without any further delay, I hand over this session to you, ma'am. Ma'am, please continue the session.
Thank you, Ravinder Kaur, ma'am. Thank you so much. First of all, I would thank my Lord Almighty for giving me this chance to speak about this topic. And I thank the Nursing Teachers Association for providing me this thanks. And it is a good initiation by our nursing fraternity. Okay, let us come into the topic without, I have been given only 1 hour. So let me complete my first session by God's grace. Good morning, one and all. I hope all are, I'm audible, ma'am. I'm
yes,
audible.
Yes, ma'am, you're audible.
Thank you. So it's about introduction to nursing theories and theory applications. Today, I am going to just give an overview about the nursing theory. What is a nursing theory? What are all the things that comes under the nursing theory? And what I'm just going to highlight the list the theories and what it is. And I'm going to detail about the Patricia Benner's theory in detail. So let us go into the topic. So theory is a group of related concepts that propose the action. It guides the practice. It guides the practice, and it is a coherent group of general proposition used as a principles of explanation. So theory is nothing but it is a it connects the concept and it helps us you to guide the practice. And what is the nursing theory? Nursing theory is a set of concepts, definitions, relationship, assumptions or propositions which is derived from the nursing models, and you have a different kind of an idea about the nursing care that has been connected towards, and it gives a systematic view of a phenomena, and it designs a specific international relationship among the concepts, and it gives you the purpose of describing the nursing care, explaining the nursing care, predicting the nursing care, how it will happen, and it will prescribe it. And also it will be a prescribing and connecting the different kinds of concepts, and it will help you to give an innovative interventions in nursing. And as per Kerlinger, the nursing theories are a set of interrelated concepts which give you a systematic phenomenon or view of a phenomenon that is explanatory and predictive in nature. And we all know that theories are composed of certain important elements like concepts, definitions, models, propositions, and that are based on the assumptions. And it has been derived from two principal methods. That is, one is deductive reasoning, and another one is an inductive reasoning. So deductive reasoning will help you to test a theory, go from a general concept to a specific concept. You can derive something very specifically, whereas inductive reasoning help you go from the specific to general, which will help you to develop your own theory. And Like see, under this the theory, the essential elements are the concepts. Concepts, you have three important concepts, that is empirical concept, inferential concepts, and abstract concepts. So concept is nothing but a mental idea of a phenomenon. They are a building blocks and a primary element of a theory. So that helps every nurses to wield the ideas, okay, join the ideas. So empirical concept is something you gain out of experience. Inferential concept is something which you indirectly observable. And abstract concept is an idea without a concrete form. So this concept form and very important essential element. Next is the construct. Construct is something, a phenomena that cannot be observed but must be inferred, and these concepts are developed for your or adopted for use of a particular theory. The key concepts of a given theory are its construct. So you need a construct, you need a preposition, you connect the two concepts, that becomes a proposition, and the process is the implementation, that action phase, how you deliver the nursing care. So that helps you to frame the theory, okay, which will include the meta paradigms of a nursing theory. And you have the variables in that. Variables are the operational form of concepts, and they define the way the concepts can be measured in a specific situation, and it will match the variable, matching the variable to the construct, so that you are able to identify what needs to be assessed and what during the evaluation of a theory driven program. So you need these important elements in your before framing a theory. Nursing theory is something a wide concept, whereas a conceptual model, when you come into concept, you're coming to something which is very specific. It represents a way of thinking about a problem, or a way of representing how complex things work, the way they do. Different frameworks will emphasize different variables and outcomes and interrelatedness. So the models will help you to draw the number of theories and help you to understand a particular problem in a certain setting or a concept that are not always specified as a theory. So when coming to the meta paradigms in nursing, so this is a very important frame that frames a nursing theory. That is, you need the for a nursing paradigm, this is the four basic concepts. That is, you consider the patient, that is a person as a whole. Okay, you come like a recipient of a care, which include the physical, spiritual, psychological, and socio-cultural component, individual, family, and community. You don't treat a person as a part; you treat the person as a whole here. So, person is an important meta paradigm in a nursing. Next is an environment. What kind of environment he lives in? What is his internal environment? What is his external environment? And next very important paradigm is the health, the degree of wellness or illness experienced by the person. And next is a very important paradigm, that is the the nursing, that is the action towards the patient care. That is, what kind of action is taken for that patient care, action, characteristic, and attributes of a person giving care. So in any nursing theory, you need these four important meta paradigms. That is a person, that is a patient that you give care, you consider him as a whole, and you need the environment, what kind of environment he lives in. It's very important for a nurse to analyze his internal environment and external environment. You cannot treat him superficially, you have to go deep inside. And then health, the degree of wellness. That the wellness is a term which explains, it's a wide concept, and also the illness experienced by the person, it will be unique for each person. So the health varies, the wellness, the degree of wellness varies according to each person. And nursing, so it is unique for each person. So the what kind of actions you do, what is the characteristic and attributes of a person in giving care. So these four things you have to remember in the as a meta paradigms. So by learning this nursing theory, what do you achieve, what is the objective? Okay, you assess the patient by various methods explaining this theory. You can identify the needs of the patient, can demonstrate an effective communication and interaction with the patient. Okay, communication skill is a very important component. Okay, without that you cannot demonstrate any kind of care. Okay, select a theory for application according to the need of the patient, and you try to solve the identified problems of the patient, and you are able to evaluate to which the process was useful. So the objectives is this for learning the theory. Okay, in practice, the nursing theories are very important. It will help you to to give you an insight about explaining the and predict everyday experience. It acts as a guide for you. It gives a rational about each and every activity that you do, and helps you to measure your quality of nursing care. And it is and you can draft a common nursing terminology even, and ideas are different. It will flow through in if you try to frame a nursing theory, and it will help you to work an autonomy that is independent. Okay, as a nurse practitioner, it will help you to work as a nurse practitioner. The purpose of theory in practice is that in education it helps you to frame a curriculum. So recently our nurse leaders and educators are developing our INC curriculum. Okay, so simply you cannot develop. You need to have a wide thought and in-depth understanding about the nursing theory. And in research, people are doing wonders in research. Okay, you get flash of ideas. Ideas flow through. How it develops? Only if you know about the nursing theory. It offers a framework of generating the new ideas. Okay, assist in discovering knowledge gaps in the specific field of study. Systematic approach of identifying question helps us nurse to question, okay, why it happens, why it does not happen. Okay, you question yourself. And approaches towards developing theory. What kind of approach can be developed? Okay, you can even borrow the conceptual framework. You use a different kinds of conceptual framework for your research study. Okay, you keep on checking out the internet, and you try to ask your mentors. Okay, that is a way the theory flows in. Okay, inductively to look into the nursing practice to discover the theory, deductively looking to the compatibility of the general nursing practice and frame the questions. All this will from practicing nurse about using a nursing theory. So the applications of nursing theory in research is wide. And characteristics of nursing theory to always it interrelate the concept, and it will project create a different way of looking into it. All will look into common phenomena, but this theory will help you to look into a different phenomena or particular phenomena, and it is always logical in nature. It will be scientifically proven, and it will be generalizable, and you can it will be acting as a base of hypothesis that can be tested. Okay, and it increases the general body of knowledge within the discipline, and uses the practitioner to guide and improve their nursing practice. And it is consistent with the validated theories and laws and principles, which will leave you open the unanswered questions that need to be investigated. That is the main characteristics of a theory. Okay, importance also we need to know. It helps you to describe and predict and explain a phenomenon of nursing. It forms a foundation for nursing practice. It helps you to generate further knowledge. It will, if you go deep into the nursing theory, it will, you will love it. Okay, it will help you to decide what we know and what need to know. It helps you to differentiate, what form the base of the practice. And you are trying to, it will help you to give a better nursing care, and it will enhance your professional status, and it will improve your communication between the nurses, and it will guide for the research and also for the education. Okay, there are three important base where which the theories are developed. We used to wonder how the theory will be developed. One is the general system theory. Like, general system theory is nothing but it teaches us to look a person as a whole. Okay, don't look as if a patient comes with a fever, don't treat only the fever of the patient. Okay, you treat him as a whole. What caused him a fever, why he's what type of fever he's having. Is this a typhoid fever, or it is because of any other infections he got? You make him understand what is the cause of the fever. Okay, for example, if it is a typhoid fever, or what kind of food he's taking out from, you make him understand. It goes into like, you health educate him. You don't treat only for the physical cause of it. You take it as a whole part, and you treat him so that he never comes back to the hospital. He realizes that, okay, of taking food from outside or contaminated water, drinking our water causes me typhoid. Okay, let me don't do that again. So that kind of idea that derives from this kind of a general system theory, where the concepts may be applied to different kinds of system. You consider the person as a whole. Okay, and you don't divide them, or you don't treat them as a part. And next is an adaptation theory. As a nurse, we need to adapt, accommodate. Okay, we learn adaptation stage by stage. Similarly, that it talks about the human adaptation in three levels, like internal, self, social, others, and physical is the biochemical reactions, like how the human adapt themselves to the disease. Okay, you get a diabetes mellitus, for example. Okay, the person first denies it. No, I don't have a diabetes. Okay, he goes to different kinds of doctors, and he comes with a different, this doctor will say no, the doctor will say no. Finally, he gets from all doctor, you are a diabetic. Finally, he come to the acceptance. Okay, and then he doesn't go with it. Okay, his diabetic level is always high, hyperglycemia is always there, or he goes with hypoglycemia. He don't know, he don't adapt himself with it. Okay, this theory will help to understand the inner adaptation of the human, how the human are adapted or to that particular illness or not. This theory will throw light towards that. Okay, so few people are able to know the adaptation of the human towards an illness as a nurse. Okay, you will be able to guide them. Okay, this is not an illness, it is a small defect. Okay, if you are going with a diet and drug and exercise and all these things, you are able to control your blood sugar. You try to understand them, make them understand that, make them adapted to it, internal self with the society and with the physical, the biochemical reactions, all those go along with that. Okay, so the adaptation theory also comes along with it. Next is the developmental theory. Developmental theory starts from the newborn till the old age, all the growth and development of the individual. I mean, it helps. I mean, it narrates that what kind of milestones in each age, the growth and development of an individual influenced by heredity, temperament, emotional, physical environment, life experience, and health status. So, based on this, the theory has been formed. So, three important thing, that is the general system theory, adaptation theory, and also the general system theory, sorry, adaptation theory, and the developmental theory. The next is the evolution of nursing theory. We used to wonder how this evolution happened. It all happened with our modern pioneer, that is Florence Nightingale. The history of the profession begins with the power. She is a modern nurse. She's the first pioneer. Okay, so she emphasized about the hygiene, maintaining hygiene, the physical, psychological and social environment. Okay, sooner or later, what happened? The strong emphasis grew on emphasis on practice, and followed by the curriculum era started, where the curriculum should be framed, and that requires more standards, and nurses started coming out to pursue more higher degrees, and this nursing practice continued to the development of nursing theory. This is the way the nursing theory began, and later more nurses grew with the master education. Okay, developmental of theory era was a natural outgrowth of research. Slowly, the nursing theory promoted the research era also. Nowadays, nursing researcher is one of the important expanded role in a nurse. And if you see the history, you have a Nightingale who is the first person to facilitate frame the nursing theory in 1860. She talked about the client's environment. Hildegard Papello, 1952, he talked about the importance of IPR. Each one took one component, and they framed in a such a way that the nursing process can be applied and tested. So Henderson's 14 basic needs, and Abdallah's focused on delivering nursing care for the whole person to meet the physical, emotional, social, and spiritual need of the client and family, and Orlando's theory and Johnson's theory, okay, which focuses about how the client adapts to the illness, and Rogers' theory to maintain the promote illness, prevent illness, and then rehabilitate the ill and disabled client through the humanistic science. Like he focused about the self-centered care of a patient, and Orem's theory, and Imogen King's, a Newman, okay, Callista Roy, Watson's theory, and all these theories were there in the history. Okay, and then here, how do you classify the nursing theory? Depending upon the generalizability of the principles, you classify as meta theory, grand theory, middle range theory, and practice theory. Meta theory is something like it identifies a specific phenomenon, a particular phenomenon only talks through an abstract concept. Okay, only when one particular concept is it talks. Like a grand theory means it will have a conceptual framework under which the key concepts and principles of discipline can be identified. Middle range theory is very more precise and analyzes a particular situation with a limited number of variables. And practice theory explores a particular situation found in nursing, and it identifies and explicit the goals and details how these goals can be achieved. So school of thought in nursing theory, they have listed the theories and the form of need theorists, interaction theorists, outcome theorists, like this. They have classified the theorists and they have put into the tabular column. And the other way, the theories also can be categorized as a need theory, interaction theory, outcome theory, and humanistic. Need theory talks about the need of the patient, what kind of need the patient has, a physical need, psychological need. Okay, it's very important for the nurse to know what actually the person's need is. So based on that concept, the theories are formed. Interaction talks about the IPR, interpersonal relationship. Outcome theory, what is the outcome out of your nursing care? That is the, it talks about that. And humanistic theory, I talked about early, that Carl Rogers has talked about the uniqueness, that is a person-centered approach. It talks about the patient-centered approach. So here is a list of the theory, which is, since because I have to do the overview of all the theories, I'm just going to highlight the what is the Florence Nightingale's theory. It is focusing on the environment, as I said before. And Ernestine Weidenbach, he talks about meeting the needs through individualized care. Virginia Henderson talked about 14 basic human needs. These theories and all, each person will be doing separately in their further session. So I'm not going to into a detail. Just I'm going to say the uh, highlight. That's it. And Abdallah's about the patient's problems in determining the patient care. And Lydia E. Hall, the nursing care of is a person directed towards the self-love. And Jean Watson's caring is universal. Her concept was only caring. Patricia Benner, this is what we are going to see in detail about all the stages of nursing practice, starting from novice till expert. And some theories comes under the conceptual model and grand theory, that is Dorothea Adams, Maria Estrin Levins, Martha Rogers, Dorothy Eve Johnson, Sister Callista Roy, Betty Newman, Imogen King, Nancy Roper, Hildegard Papello, Ida Jean Orlando, Joyce Travelby, Human Relationship Model, Catherine E. Bernard, and Romano T. Merces, Catherine Calabos, Mandolin Leningers, Rosemary Rizzo Pars, Nola G. Pender's health promotion model. So this and all, don't worry, participants, all these theories, they are going to, each person will be explaining in the further session. So today we are going to see about the Patricia Benner's theory, very interesting theory. Dr. Patricia Benner introduced the concept that expert nurses develop skill and understanding of patient care over time through a sound educational base as well as a multitude of experience. So her focus was about the gained experience. Like she proposed that one could gain knowledge and skills knowing how without ever learning the theory knowing that. Okay, she further explains the development of knowledge in applied disciplines such as medicine and nursing is composed of extension of practical knowledge, knowing how, know how through the research and characterization and understanding, know how the clinical experience happened. So her main concept was prerequisite was the about the nursing skills as experience. To become, you need a nursing skill, you have to acquire the nursing skill, and you have to build, update your skills all the time. That was her concept. To talk about Patricia Benner, she's working as a professor at University of California. She did a BSc in Pasadena College and a MSc in from University of California same, and then she did her PhD in University of California, Berkeley, and 1970 she did a lot of researches in that. She had published around 9 books, and she received a Book of Year award from AJN. And like these are the books I have highlighted: from novice to expert, primacy of caring, interpretive phenomenology, crisis of care, expertise in nursing practice, and lot. And she's an internationally noted researcher, lecturer on health, stress, coping, and skill acquisition. She's elected as a honorary fellow for Royal College of Nursing. She worked as a staff nurse in medical surgical nursing, emergency room, and coronary care, intensive care. Currently, her research includes the study of nursing practice in the intensive nursing care units and nursing research. So she developed this theory. She was influenced by Dreyfus model of skill acquisition. Her theory was based on the Dreyfus model of skill acquisition. She believed in the skill acquisition. Like according to her, The skill is a utility of concept of skill lies on the helping the teacher to understand how to assist the learner in advancing to the next level of level of the student. Okay, M. MacLeod in 2005. So she was depicting this idea of MacLeod, like you have to help the teacher should understand the level of the nursing student. That is more important. What is the level of them? Each student is unique in learning. Okay, unique in getting. Some student will quickly learn the skill. Some will be good in knowledge. Will be acquiring the good percentage in their +2. But when they come to nursing, their skill level will be little less. Theory they may score more, but practical, when you come to practical, no, they will be little slower. Some students, I'm not telling all of them. So it doesn't matter. Okay, what you score in the +2 doesn't matter, but how do you improve your skill? How do the teacher know the skill of each student? That matters here. If the teacher is able to know mend a student, like the potterer who do the pot, each pot, no, different pot, he knows, like that. If the teacher it is, this is a theory developed for each teacher to mend a student in each level. Okay, that is what. So here is a Dreyfus model of skill acquisition. So there she found that how the skill varies, starting from novice, advanced beginner, competent, proficient, and going to the expert. So she started going through, and she explained that uh, her 5 level of capabilities. She explained as capabilities: novice, advanced, beginner, and competent, proficient, and expert. So what a teacher should do in this each stage, what should be the role of a teacher, how she can help a student to gain the experience. Her research was aimed in discovering what will be the difference in experience of a same situation, of a same clinical incident in each level of the student, right from novice to the expert. Some small incident she has taken, and then the same incident she will put for all the stages, and she was trying to differentiate what will be the outcome from each stage. And she described as all this 5 level. The novice, we know novice, we can compare it with the first year students, like the person who don't have a background experience of a situation where in which he or she is involved, and there will be difficulty in understanding the what is relevant and irrelevant. And usually the novice will have no experience, and you have to really, it is like a raw ground. Okay, it is a very important crucial period for every teacher to inculcate the meaning of nursing into each first year. Okay, so the rules are contest free, independent of specific areas, and applied universally. Especially inculcating the concept of nursing process, it is a very difficult task for every nursing teacher. Okay, and what will be the output of the each first novice will be like, tell me what I need to do, I will do it. This will be the level of the nursing student. Okay, so every teacher should understand that these first year students will know everything, so we can just leave them and go unsupervised. So nowadays I could see many nursing colleges are leaving the students in the clinical setting without supervision. It's very bad to see that every student should be supervised, every novice should be supervised by an expert, and she should realize the exact learning needs of a novice. Okay, and try to help. Next is the advanced beginner. We can compare them with the second year students. Like they try to understand nursing and they try to show some acceptable performance. Can you leave this advanced beginner just like that? No, they need a mentor, a supervisor along with them, because they have just progressed towards from novice to advanced beginner. So our gained experience, prior experience is actual situations to recognize reoccurring meaningful components. So nurse functioning at this level need to be guided by rules, oriented by task completion. She always require a mentor and always require an experienced nurse. And if she has to, the mentor has to define the situation, set priorities, and integrate with the practical knowledge. And I always advise, like the person who teach the theory should come towards the clinical setting and help the students to start their nursing. So to create a compassion in nursing is a very important task of each teacher. And next level, when you go to third year, you can compare them with the third year, like, or any nurse who completed nursing who attained the third year can be compared to competent level. Like after 2 to 3 years of nursing, they move to the stage of competent level. Okay, so most pivotal in clinical learning because the learner began to recognize the patterns and determine the elements of a situation warrant attention. So she devises new rules and reason. She tried to reasoning out what I have learned. Is it, and she's more aware of long-term goal. She becomes more responsible when she becomes a competent person. She becomes more responsible, and she gains more perspective from planning the own actions based on the conscious, abstract, and analytical thinking. She uses the analytical thinking and she uses the previous knowledge and she tries to achieve the greater efficiency and organization. Can you leave her alone? See, she also needs some sort of supervision from the expert. All the time she need not be supervised. And when it comes to provision, she comes to the level of 4 years. So we call them as provisioned nurses. A nurse possesses a deep understanding about a situation. So far, she would have done for a completion of care plan sake or completion of that particular task in nursing. But here, this stage when the nurse comes, she will have a deeper understanding about a person. She considers the person as a whole. Okay, she tried to treat the person without a mentor. Okay, without a mentor, she tried to express her nursing care, a skilled response to the situation, perceives and understand the situation as a whole part, more holistic in understanding, and improves the decision making and learns from experience. No more she uses analytical thinking, she uses a critical thinking, what to expect in certain situation and how to modify the plan. Next comes the expert. So after you gain your 5 years, so you become an expert, you need not be supervised. So she no longer relies on the analytical principle and all. She has a rich experience, background experience, and quickly she will grasp out the situation, and quickly she completes the nursing care. Okay, she helps to she knows to manage what kind of what may be the situation. She will be able to manage it. Okay, she operates from deep understanding and a total situation. So here Benner talks only about the gained experience. She talks about the importance of gained experience, which will be unique for each nurses. So she has also given a guidelines for advanced practitioner in nurses, how the in what level the novice will be, what the teacher should learn, what will be the emotional feeling of the nurse, what will be the emotional educational needs of the novice. Like that, she has given in different for each person. And she has also given one checklist for a starting nurse. Like you have to in certain colleges they don't do the initial assessment. In few colleges they do once they admit nurses. Like as you admit them, you have to really examine them, physical examination, psychological, counseling, everything is required, because actually you should know what kind of nurse you are going to get, and really do they have an interest, or whether they come with the force. That and all is very important. Okay, so initial assessment is very important whenever they enter the nursing practice. It's very important. It is a crucial period for the for the crucial period for the nurse teachers to develop them and to groom them into a good nurses, quality nurses. So, and coming to the application part of a Benner's theory, it helps us to frame a curriculum for nursing school and build a clinical ladder for nurses, and a lot of mentorship programs can be developed from this, and development of clinical simulation protocol also can be done, and based on the all this can be developed only based on the 4 domains meta paradigms. I already have told about this. And according to Benner, person is a self-interpreting being. That is, a person does not come into the world predefined, but gets defined in the course of living a life. So each person's experience is different. You cannot apply the same experience to everybody. So it is in what she's coming to say out of this as a person. So when you get a patient, you have to examine him, gain experience out of it, see the situation. Okay, and you cannot compare the experience with the other patient. Okay, it is very important to know that the person gets defined in course of living a life. So she explained the person as a person like this. And health, according to her, what is health? It's a lived experience of being healthy and being ill. And she defines health as a what can be assessed, whereas well-being in the human experience of health as a wholeness. She defined health as a wholeness. Okay, well-being and being ill are always understood as a different way of being in the world. So she explains health as a wholeness. You cannot treat only the signs and symptoms. You have to treat the person completely. That is what her idea about health. And environment and situation. She focuses more on the situation what it is than the environment, because situation conveys a social environment to the social definition. She explains that to be situated implies that one has a past, present, and a future, and all of that, these aspects influence the current situation. So she explains every patient will have a different situation, and based on the situation, the further process of nursing care should be framed. And according to her, what is nursing? Nursing is described as a caring relationship and enabling condition of a connection and concern. Caring is primary because caring sets up the possibility of giving and receiving help. The nursing is viewed as a caring practice whose science is guided by moral art and ethics of care and responsibility. So Dr. Benner understands that nursing practice is a care and study of a lived experience of health, illness, and disease and relationship among the three elements. So she focuses more on the lived experience, so which will vary from each person to person. It is a responsibility of the nurse teachers to identify and help each nursing nurses in what level they are. Accordingly, you help them to understand the lived experience of each patient. So she has been focused as a modern theorist of understanding the increased acuity of the patient, and she talked about the early discharge, and she made the hospital survival like possible through this theory only. Like it made us to understand the level of clinical competence, so that based on the level of competence we can assign nurses. So that was the very much importance of this theory, and what nurse leaders can do by learning this theory. Leaders can be a, can frame a new residency program and understand their competency and improve the confidence satisfaction of the newly coming nurses, and maintain a good environment, provide a good healthy working environment for nurses, which is not at all available in COVID-19. We are aware of that. Okay, so we are aware, nobody talks about the, I mean, people are only talking and people are not there to provide the adequate PPE for the COVID-19 nurses. It's very important here. Just I'm highlighting the here nurse leaders, what they can do, maintain a healthy working environment. That is what Benner, from Benner's theory, we are able to understand, so that they get a good supporting experience for them. And and also shaping the future nurse leaders. That also can be possible through by the reflection of this theory. The positive experience will encourage our proficient nurse to mentor a novice nurse and give them a same positive experience. As William Arthur said, the mediocre teacher tells, a good teacher explains, a superior teacher demonstrates, a great teacher always inspires. So we all should become an inspired teacher. So what is the significance of this theory? The theory most its reflection from reliance on past abstract principles. It uses a past concrete experience as paradigms. Change in the perception of situation as a complete whole in which a certain parts are irrelevant. Each step builds on the previous one as abstract principles are refined and expanded by experience, and learner gains a clinical expertise. So she always tells the nursing can be built not in a day, it goes by experience. Every day is a learning day for a nurse. So it is like nurse teacher should understand what is the level of a novice, what is the level of advanced beginner, what is the level of a provision competent, what is the level of. So based on that only you can assign the nursing care. Okay, so that things we are able to understand, and that this theory changed the profession's understanding of what it means to be an expert, placing this designation not on a nurse with the most highly paid or most prestigious position, but on a nurse who provided most exquisite nursing care. It is recognized that nursing was poorly served by paradigm that called for all of the nursing theory to be developed by nursing researchers and scholars, but rather introduced the revolutionary notion that the practice itself could and should inform as a theory. So it becomes a revolutionary theory for all the nurses. So from this theory, there was a person called Kevin Arnold. He could develop a course on challenges of central line associated bloodstream infection. called as CLAPS, central line associated bloodstream injury. From this theory, she developed a course and she able to successfully implement that course. What are the challenges faced by the nurses in all level, like right from the beginning of novice till the expert, what different experience will be there. So she did in KLA Education Services by accredited by State of California Board of Registered Nursing. So the concept is considered excellent care practices gained through the evolutionary process grown from the experiential learning and transmission into the practical skills. She stresses the importance of retaining and rewarding the clinicians for their expert. So this Kevin Arnold was inspired by the Patricia Benner's theory. She developed this course and she tried to implement this course and found to be successful. Her central concept of this competence were skill acquisition, experience, clinical knowledge, and practical knowledge. So based on that, she could apply the practice of Benner's model through this CLAPS, that is the central line associated bloodstream infection. She could able to implement through this model, and she proposed the 7 domains of practice in nursing, like a helping role, teaching role, diagnostic client monitoring role, effective management of rapidly changing situation, administering and monitoring therapeutic interventions and regimens, monitoring and ensuring quality healthcare practices, organization of the work role competencies. All the 7 domains she able to examine this. There are a lot of literatures coming out by inspired from the Benner's model. Through Singhal, many people have done research on this and they are found to be successful. McWen and Wills, they did a longevity study to determine how the clinical decision making skills were acquired. And there was an article by Dest who described the importance of mentors during the professional transition to expert. And there are a lot of researches done under this. So through this Benner's model, this Kevin Arnold was able to provide a safe and effective care. She could analyze each level of the nurses, from starting from novice, how safe and effectively they handled the central lines, the tubings, the needles, the dressings, the infusions, blood culturing, flushing, what and all, how they did. And she also acquired how, what kind of skills they acquired, what was the knowledge level obtained by, like knows that and but knows how much they go to the level of knows how, that was stressed by Benner. So this was cross-examined by this Kevin Arnold in this course, that is central line associated bloodstream infection. She could analyze and she could implement a training and competency model based on the Benner's program, could help to structure the need of successful prevention program. She could implement it. This was the success of this theory. So practically what can be applied in this? So expert nurses will have a ability to know how to mentor those needs in a proper skill and knowledge. And these nurses should stay updated. This is what the theory tells you, updated and best practice by serving on key committees and active members of the key professional organization, also like Association for Vascular Nurses and Infusion Society Nurses. They also was inspired by this theory. And the skill necessary for proper care of central line need to be taught through demonstration only, not through online. And Benner concept of reflection can use to bridge the gap between theory and the actual skill. And this can be an appropriate for the nurses and patient family, performing a written demonstration, further proving that they have the knowledge and know how when faced with a situation or a task. So Kevin Arnold could prove that she could develop a course and she could conduct a prevention program among the nurses that she has. She could analyze her skills, the gained experience of each level explained by Benner, and she found that the Benner's theory could help to bridge the gap between what is taught in the classroom could be implemented in the ward setup. And she also found that the teachers, nurse teachers, need to be appropriate, and they should guide them on each level. And deeper meaning and skill can be enhanced by reflection in the practice and leadership and education. To conclude the theory of Benner, the nurse practice is guided by a human becoming a theory, process of past practice and methodology, and illuminating the meaning and synchronizing the rhythms and mobilizing the transcendence. Research guided by the human, becoming a theory, sheds a light on meaning of universal humanly lived experience, such as hope, taking a life day by day, grieving, suffering, and time passing. So what I am coming to tell is, out of this Benner's theory, we should understand that every nurses are learning the experience day by day. As a nurse teacher, we should be beside each level and we should be helping them to understand what is nursing, what is the concept of nursing, what do you understand by caring, and you should not leave the students helpless, and understand the level of nursing and assign the cases accordingly. Okay, and many are benefited out of this Benner's theory, and I have concluded the topic, uh, and thank you.
Thank you, ma'am. It
And
was really a wonderful presentation, ma'am.
thank you.
Ma'am, we have a question in QA box that
uh,
you already covered. Can I check?
you can change.
Okay, ma'am. The question is that how we can apply theory in clinical situation with an example.
Clinical situation with an example for Benner's theory, ma'am.
Yes, ma'am. For
See,
any theory.
Benner's, yeah, clinical situation with an example, as I told you, no, novice is a person will not understand what is the hospital acquired infection. Okay, hospital acquired infection is something like which you get after coming to the hospital. Okay, so when it comes to the Benner's theory, it has been learned through gained experience. So as a nurse leader or a nurse educator, as a nurse teacher, whoever beside the novice should be able to mend the student, okay, help the nursing student to understand what is hospital acquired infection. So this has been proved by evidence based nursing care. It's one of the evidence based nursing care example it is actually. So understanding level of the novice will be different in each level, right from novice next to the advanced beginner, next to the expert, on each level. So it is very important to, before you develop any theory, you should understand the what level the student stands there. So the one clinical example is this only I can quote is a hospital acquired infection. The understanding of the novice will be different. The understanding of the advanced beginner will be different. The understanding of the other patient will be different. So everywhere the nursing skill is acquired by the gained experience. So as a nurse teacher's role, when you talk about nurse teacher's role, she has to guide each level she has to guide the student to understand and talk about the aseptic practice, make them practice. First year slowly they will understand how to do the hand washing, how to do. So when they become an expert, that the achieved experience is different. Each level, if you could imagine the outcome of a novice and outcome of each advanced beginner, it will be different. So in each level you need a mentor all the time, and you need to help the students to understand how you can help a student to gain the experience. So this is what I could explain for this question, ma'am.
Thank you so much, ma'am, for the clarification. Ma'am, you have explained really very well about the topic. So thank you so much for imparting knowledge regarding overview of nursing theory and Dr. Patricia Benner's theory. Ma'am, Poonam, can I?
You can exit, no, at least.
Hello.
Yes, ma'am.
Hello.
Yes, ma'am. Now I can clearly hear.
Yes. Actually, it was a very informative session and well elaborated by you as well, ma'am. Actually, in chat box, I found one thing. One participant is there named Nithya. She's asking, ma'am, do you have any tips so that we can easily remember all the theories, at least components?
Components of theory, that is what meta paradigm. That's what I told you, no? 4 meta paradigms are there: the patient, health, environment, and nursing. Any theory you take, it will revolve around this 4. It's like a framework, it is like a base for any building. So without that, the theory never goes out. You have a client as a pillar, one like a pillar of a building. All these paradigms revolve around this. There is no mnemonic as such to remember all those things. You understand each theory and what you can learn out of this theory. That is more, I feel that is what more important in knowing the theory. In Benner's theory, just now I had a talk on that. So what you understand, the gained experience is more important. The teacher should interpret what a student, first year level, what they are learning, second year what they are, third year what they are, fourth year what they are. So that gained experience, it should reflect in your daily practice. Like you cannot assign a first year to to a labor room. You cannot do that, isn't it? The gained
Yes,
experience, what you learn from the theory, I feel that is more important than learning a mnemonic, so that you will.
yes, yes, ma'am, definitely.
Framed so
Uh,
far. Sorry to
what
say.
is the core concept of theory? In our student time, when we were studying in masters, we used to make a big chart paper. We used to take a chart paper and we used to frame Florence Nightingale environmental theory. So what she has told, just in a box you can write the content you understood with the particular theory, so that you can understand, at least you will be remembered those theories,
Yeah,
I think.
yeah.
Ma'am, next, one more query we have. Can we apply multiple theories to single patient care?
Multiple theory to single patient we cannot apply, ma'am. It
Okay.
depends actually. It depends on the situation. Multiple theory it cannot be applied. Single theory, that's what it differs. It differs accordingly.
Okay,
It
ma'am.
cannot apply it.
I hope we have done with everything clearly, as you have explained very well, and all the respected participants as well, I must say, because many of the participants are the respected principals, vice principal as well, faculty from various colleges are attending this session. So it was very helpful for all, as I'm getting in chat box also the reviews. So it was very great session by you as well, Ravindra ma'am. Very well managed session. We are very much thankful and obliged that
Thank you, ma'am.
we got you as resource person.
Thank you, ma'am. Thank you so much.
So one more thing, ma'am, I would
You
like
can
to
share the
extend my
PPT also. Whoever asks, you can share the PPT if anybody requires.
Yes, ma'am. We will talk regarding that. Actually, everyone is asking for PPT, na ma'am.
Please share.
So some of the resource persons they are not agreeing actually to share
Oh,
their PPTs. But although we can share your PPT, as you are have given your consent,
yeah,
ma'am. So we
yeah.
will share your PPT, and I would like to inform each and every participant that on YouTube channel, these all sessions are recorded and going to channelize over there. So anytime you can view these sessions, you can watch live on YouTube also, as well as ma'am has given consent. We are grateful to you, ma'am. So we will share the PPT of first session also.
Thank you so much. Thank
Ravindra
you.
ma'am, over to
yes,
you.
ma'am. Okay, thank you, ma'am. Thank you so much, Dr. Nisha, ma'am. Now, I would like to extend my gratitude from the bottom of my heart to Dr. Farooq Khan, President, Dr. Manish Kumar, National Secretary General, and Professor Poonam Thakur, Treasurer of the Nursing Teacher Association of India, for giving me this opportunity to act as a moderator. Thank you so much, ma'am. Last but not the least, thank you all the participants for joining us, and see you all tomorrow in next session. Thank you. Have a nice day.
Thank you so much, Ravindra ko. Thank you, the entire Nursing Teachers Association team. I'm grateful and thank you. Thank you so much.
Thank you, Nisha ma'am. Thank you, Ravindra ma'am, for your gratitude, well expressed. There is little bit notification. I would like to notify something for all the participants. Dear all, as we are mailing the joining info via your mail IDs as provided in the registration forms, but due to some network issues or errors, sometime it is not delivered to few of you. So today onwards, we will put all the joining info on WhatsApp group itself, so that easily each one can join the sessions hassle free. And those who haven't filled their registration forms but they have paid the amount, please provide your information on individually on my WhatsApp. Don't put in that group WhatsApp, as it may create issues or problem to others also. Every time they will be getting their phone ping ping. So do it on my individual number. You can provide your name, your information, so that there should not be any problem while the time of e-certificates.
I appreciate all
Thank you.
the entire crew who has done very in organized manner, right from the start till the end. I think this should go on.
Yes, sir, definitely, ma'am. With your support, we will move
Yeah,
on, and
do my best.
this is all your blessings and all your efforts, guidance as well.
Very nice, ma'am. Thank you. Thank you so much.
Thank you so much. Have a great day.
Thank you. Have a great day too. Thank you.
Okay. Goodbye, participants. See you tomorrow.